I'm Heather Moore, Program Director for the UAMS Hospice and Palliative Medicine Fellowship. Our program is a one-year adult fellowship at the University of Arkansas for Medical Sciences in Little Rock. We are the only HPM fellowship program in the state embedded in the only Joint Commission certified palliative medicine team. Our fellows rotate through a variety of clinical environments, including the UAMS Winthrop P. Rockefeller Cancer Institute, the John L. McClellan VA Hospital, which is conveniently located across the street from UAMS, and Arkansas Children's Hospital, as well as Arkansas Hospice, one of the largest community hospice providers in the state. We have been fortunate to have fellows with backgrounds in multiple specialties, including internal medicine and family medicine, as well as anesthesia, obstetrics and gynecology, and neurosurgery. The goal of our program is to develop fellows who successfully practice palliative medicine across multiple settings. Our graduates have gone on to careers in ambulatory and consultative palliative medicine in both private and academic settings, hospice care, oncology, rheumatology, and primary care.
This is an academic program. This is an academic hospital, and the scope of the fellowship is really focused on inpatient complex palliative care. And yes, we have hospice rotations and we have outpatient rotations, but the bulk of the program is inpatient and with complex palliative care patients. And my philosophy has always been, if you can do complex inpatient palliative care consults, you can do anything.
With some palliative care programs, you may not see a high level of acuity, or you may only see one certain segment of the population. So here at UAMS, we have a very broad segment of the population and the people who come for palliative.
I've been very well prepared for my future practice. We see a lot of pathology here, and I'm pretty sure I have talked to every subspecialty in the hospital. Internal medicine, oncology, even the surgery subspecialties. And I feel like even though there's going to be a learning curve as an attending, I have a great foundation. We see clinic, we see inpatient, we have a hospice unit. I can titrate meds in the clinic, and I can do PCAs and ketamine infusions. So we have a lot of great learning here and a lot of good support that I know that come next year I'll be okay.
We've graduated 11 years of fellows, and every fellow will come back and say, there wasn't anything that I didn't see in fellowship once I got out, into the real world. Little Rock is kind of a big small town. It is, I think it's the perfect size personally. You don't feel like you get lost. There is a lot to do around the city, and places to eat, places to visit, and you're in good driving distance between other big cities like Memphis or Dallas.
I'm going to be honest, I was pleasantly surprised to move here. Being from New Orleans and the city had a lot of culture, I was a little concerned, but it's kind of a hidden gem. If you outdoor stuff, hiking, biking, the river is great, and surprisingly a very good amount of food. As a foodie, I really appreciated the number of restaurants here. So.
Fellowship is hard enough, and that'll be hard wherever you go, as far as that you're learning new things and you're trying to find what your own style is and training, what you want to learn. But I think you want to do that in an environment where people are nurturing, where the faculty care about you, where the other people you pass in the hallway have a general concern for your guard. And I think that sums up this facility very well. There is a great concern for not only the training and the expertise level of the fellows that we want to take when they leave here, but there's also a concern for their well-being. It is not acceptable for us for someone to be miserable in their fellowship or to find that something's there. And we're very open to our fellows in incorporating feedback or looking at the things that they feel sort of important for their future career. And I think that goes a long way towards the character of this program. A lot of people are going to read the same books place in the country, but where you read them or who you read them with will sort of make the difference. And I think this is a very compassionate, positive outlook program.
I would say basically, first off, kind of go with your gut. You're going to know if something feels right or not, even if it's virtual. You'll have a feeling about it, and give us a chance. Little Rock sounds like, why would you move there? It's the middle of nowhere. I thought that same thing. Really glad I moved.
For more information, including eligibility requirements, please check out our website, and thank you for your interest.